I'm Dr. Deepak Shivarathre. I'm one of the orthopedic surgeons. I head the Spire Clinic group. I specialize predominantly in joint replacements, musculoskeletal tumors and sports injuries. I have a keen interest in megaprosthetic replacements and dealing with complex neglected trauma as well. Arthritis of the knee joint is nothing but wear and tear of a cartilage. Cartilage is nothing but this blue coating that surrounds the knee joint. This is the thigh bone, this is the leg bone, and this is where we move the knee joint very well. And this smooth surface, this smooth blue coating allows for the knee to move without friction and also acts like shock absorbers when we keep walking. Now what happens as we grow older and as we keep using the knee, just like the tires of a car, the cartilage also starts wearing out, and you can see these pieces coming off from both sides. With time, as the age progresses and the arthritis advances, there's a complete loss of the cartilage and the smooth coating completely disappears and the bone gets exposed. The bone starts touching the bone and causes a lot of noise, a crackling sensation and constant pain. What happens once it reaches this stage is, unfortunately, the painkillers, the injections, the gels or the physiotherapy stops working and it causes severe pain. See, whatever we do at that point of time in terms of tablets, it sort of temporarily gives you that relief but does not solve or cure the problem of smoothening this joint out again. Now, that is what we do in a knee replacement. That's probably the time when you consider surgery to smoothen this out. What we do is basically smoothen this joint out. We flatten the surfaces, make the knee joint straight again, and put a polished titanium or a cobalt chrome alloy surface again. It's just the surface which has been replaced, and we also reposition the cushion back, and this starts moving smoothly once again in a fantastic manner, just like how your original joint was. This is what is called a knee replacement surgery, and this has been proven to be a very successful and a very reliable way of treating arthritis for a long time now. Millions of people have had benefit from this surgery, and this is the only definitive permanent solution for end stage knee arthritis.